Acne, it's not only a self-esteem issue when a person has it, but when it clears, it can leave embarrassing scars. Dr. Max Adler of Park City's Dermatology knows how to improve scarring, and he's here along with his patient, Veda von Bergen. How are you guys?
I'm doing fine, thank you.
Very good to see you. And Veda, we'll get to you and your testimonial in just a minute, but let's talk about what this new procedure is that really is going to help people.
Well, it's not new, really, Amy. You know, we see a lot of patients who have acne problems, and we're always trying to help them, but sometimes people come in and they have some active acne, but they also have some scars that they've accumulated through the years as well. So we've got to try to do something for the scars. And these procedures aren't new, but when you combine these procedures, you have a much better chance of getting a good result.
Okay, let's talk about the two procedures we're combining. Subcision, how does it work?
Well, in subcision, we take the area that shows some scars, and we numb it so that the patient is comfortable, and then we use a small instrument underneath the surface to break up the scar tissue a bit. And what this does is it allows the surface skin to float to the surface. It isn't any longer tethered like a balloon would be tethered down. So once those scars are freed up, part of your improvement is going to be seen right there.
So it's almost immediate, some of the results.
Those results can be seen. There's a little bit of bruising afterwards. Veda will tell you about that in just a minute. But it really looked better just after the subcision procedure.
That's fantastic. Okay, so what is Fraxel and how does that play a role?
Well, the Fraxel laser has been around now for a number of years. And the particular model that I've got, we use a lot for lines and wrinkles, but we also use it for acne scars. And what it does is it puts heat down into the skin to help remove the collagen that is abnormal, and it helps it heal better so that it is smoother. So instead of having jumbled up collagen, you're laying it down smoother so that the skin surface looks smoother.
That all makes sense to me, Max. Okay, so let's talk to Veda because she is the stunning young lady that's sitting next to you, and I would never think that you had a problem with acne or scarring, but you did. How would you describe your skin before you sought treatment with Dr. Adler?
Before, there was a lot of pigmentation from previous acne, and there was scarring, and along with the indentation of the acne as well. And when you put makeup on it to try to cover it, you would still see the indentations with the lighting.
And I would say we're seeing your before picture here, and we can see that this was something that is pretty drastic on your skin, these scars were.
It's really hard to cover up.
Is it hard for you to even look at those pictures to remind you kind of what it looked like before?
I don't have any pictures like that. I've deleted them all.
Okay, and so obviously now, how would you describe your skin? Is it completely different?
Just right after the subcision, I went home and I washed my face just to get some of the numbing gel off of it, and it was just like a noticeably smoother difference, and it just, you could feel it immediately, and over time it just got smoother and smoother. And then when we did the Fraxel about a month later, it was just all the pigmentation, it was just like slowly, everything just started fading.
And we're seeing her after picture, and this is a typical result. You really hit a home run with her treatments.
Those are no makeup pictures.
And she just wants to mention those are no makeup pictures, which actually shows the results even better, right, Dr. Adler?
Well, certainly. And if you still have some residual minor scarring, then if makeup can make up the difference with that, it's still an improvement, and it's going to be very helpful for the person.
And for Veda, this was, this was affecting her income. I mean, what she does for a living, she's a print model. So certainly you had to take certain jobs that they could airbrush or do some things in post, and it affected what jobs you could book.
Right, definitely.
And so how about now? We're looking at some of your modeling pictures. These were taken after you received treatment through Park Cities?
Yes, absolutely. But it's like so much easier just to go into a shoot because you show up without hair and makeup done, and when you show up without any makeup on, you just feel sorry for the makeup artist that has to spend twice as long on your face as everybody else is. And so it's really nice to be able to go in there and
so certainly it's affecting your job, but also I'm sure it affects your self-esteem and just every day. Sometimes we just want to go without makeup, right? Veda, as women, we don't always want to have to cover up, especially if you wear makeup for a living as a model. And now you can go and run out of the house without makeup and feel confident.
Absolutely.
That's a big deal, and I'm sure you hear that a lot.
We do, and it's always a pleasure to be able to help somebody. And Veda's a wonderful representative for our office and for the Nancy Campbell Agency. We're happy to have her.
We love the Campbell Agency. I'm with them too. So you want someone to come in maybe for a consultation if they think they have this scarring that they thought maybe was irreversible, or they're trying to cover up on their own, they should come in and see it.
Oh, certainly. It's going to, what we do is going to vary from person to person. It has to be personalized to the individual problem that we see.
Okay. Sometimes you like to go without makeup too, Dr. Max Adler, right?
I don't have any makeup
all
on.
the time. That's all natural skin. Awesome. Well, Veda, thanks for sharing your story with us today. We appreciate you being here too. You can always find out more by visiting the Park City's Dermatology office on Douglas Avenue in Dallas. Give them a call. It's 214-692-7447 or log on to dallascosmeticscenter.com.